Hello and welcome to Dollars and Cents, the Australian Institute podcast where we're talking about just what the hell is going on in the economy. I'm Elinor Johnston-Leake, the senior content producer here at the Australian Institute, and as always, I'm talking to our chief economist, Greg Jericho. But it's a bit of a somber mood today, isn't it, Greg?
Oh yeah, let's not sugarcoat it. We're all pretty depressed here, but we will try and do our usual. What am I talking about? We're never optimistic or joyful here. It always ends up being depressing anyway. So maybe this is the podcast for you today. If you like feeling depressed,
although if you're listening to this and not our colleague Dr. Anna Shortis's podcast After America, maybe you're looking for a bit of a reprieve from US election commentary, which hopefully we can provide
a little bit,
not dwell too much on that.
We'll keep the focus on Australia a little bit.
But if you want more information, we did do a couple of episodes earlier on about Trump's economic policies. So if you want to know more, you can listen to those or After America, which is incredible.
Yeah, absolutely. I mean, much as I'd love to talk about tariffs and how Trump is going to gut the public service in America and send everything horrifically.
Let's not do that right now.
But I think we will at some point, especially once Trump is in and we start seeing what he's actually doing, we probably will have to return to it to think about what's going to happen to Australia. And more to the point, because I think this is what everyone's a bit alert to at the moment, is what does this mean, especially for what the opposition might be thinking they can propose and get away with in the run-up to the election? What lessons are they going to learn, and what perhaps lessons are there for the ALP, if any?
Yeah, we'll see. Yeah. So just on the US, one of the policy areas they're pretty famously terrible at is the healthcare system. They rely a lot on private healthcare.
Our legislative work starts with repealing and replacing Obamacare and saving families from the catastrophic rise in premiums and debilitating loss of choice.
So just a yes or no, you still do not have a plan?
I have concepts of a plan. I'm not president right now. But if we come up with something, I would only change it if we come up with something that's better and less expensive.
It wasn't just because before the law was passed, insurance companies could just drop your coverage because you got sick right at the time where you needed insurance most. It was because of you. It was because of the stories that I was hearing all around the country and right here in Florida. Hearing from people who had been forced to fight a broken healthcare system at the same time as they were fighting to get well.
In Australia, we like to think of ourselves as having a pretty robust universal healthcare system. But I don't know about you, Greg. I've been finding it pretty difficult to find somewhere I can get a bulk bill GP appointment. Can we actually be that smug about our healthcare system here in Australia?
Yeah, I think let's sort of talk about the US. I mean, infamously bad. Yeah. And acknowledged by everyone. And for anyone who's traveled, if you ever go to America, the first advice is make sure you have travel insurance.
Yeah.
Otherwise, because if you trip and fall, break your leg, anything bad, you are in big trouble if you're not insured.
Yeah, so it's a bit of a meme that you can go to the hospital for really nothing at all and get into a large amount of debt.
And it's a real sign that it's not just about how much you spend, because America spends more on healthcare than pretty much any other nation, certainly any other nation in the OECD, and I think we can basically say any other nation in the world on a sort of per GDP basis.
Even though it's private healthcare.
And so it spends a hell of a lot of money, and this is Americans and the government spending a hell of a lot of money, but their life expectancy is among the worst in the OECD. Not even good for sort of developing countries. And it pretty much is a prime example that when you're spending all your money on private health, and especially private health insurance, that is not a good way to deliver a good outcome for your society. And it's just the prime example that public services such as health are best done by public sector, not by profit-making organizations, because if you think that is the way, look at what's happening in America, and unless you're
not very efficient.
because most of the money is going to profit. It's not going to actually delivering services. It is going towards things that ensure that these private health insurance, the private health providers make money. And that is the whole point of the private sector. And it continues to amaze me that people think, whether it's related to transport, whether it's related to housing, whether it's related to energy supply, that, oh my God, the private sector likes making a profit more than they actually like delivering the service.
Who'd have thought?
Yeah. But it very, very much applies to healthcare. And as a result, I'm always very concerned when I hear any politician start talking about how vital it is that our private health system and our private health insurance system is working strongly.
So what's happening to Australia's healthcare system then?
Well, as you know, we are, around the States, there are, I don't want to say it's a crisis situation, because Australia comparatively does have a pretty good healthcare system in terms of our outcomes per how much we're spending. We're not overly reliant on the private health system, certainly not like America. We are a bit more reliant on the private health system than most of the OECD. And what we see, though, is each year we see private health insurance companies come to the government and say, we're struggling, we need to raise our premiums. Can you allow us to raise our premiums by a certain amount or by more than we need to? And it's all under this guise that we need the private health insurance system working.
I didn't realize that was something that they would need to go to the government to ask if they can do.
The private, and this is something a lot of people mightn't realize, is that the private health insurance industry is really highly regulated in the sense that actually, yes, governments are able to put in kind of price caps. And it's not a specific price cap. What it will be is an industry-wide average price growth that they're allowed. And so each year, generally in around February, March, the health minister will announce what the price increase will be on average for health insurance premiums.
And so what are they asking for?
They want this year, the word is they want about a 5 to 6% increase in their premiums, which is a lot, but surprisingly, or perhaps not surprisingly for anyone who's got health insurance, it's about the average of what we've seen over the past 20 years. And when you realise that we sure as heck have not had average wage rises of 5 to 6% each year, it means that private health insurance has become much more expensive, and it's a product that is delivering less and actually costing more.
Yeah. I mean, I don't have private health insurance. I've sort of looked at it and gone, why would I pay this much when, there's only so much I could really get back? But then I learned that you have to get it by, what's the
31.
Yeah, you have to get it before you're 31.
I was going to say, there's a reason why you don't have private health insurance. And I was going to say, I'm betting you're younger than 31.
I am,
she's younger
but
than
not
31.
for too many more years. So I'm getting a little bit annoyed about this. It seems like a bit of a scam. What's the reasoning behind this, Greg?
Here we need to have a bit of a history lesson. So strap yourselves in, folks.
Oh, God.
This legislation will make community health centres possible, which has not been possible in the 23 years that the opposition had the chance to provide a health service to cover Australian people.
The public interest is the interest of every individual in Australia. It's not a collective thing. We're not a collective mass. We are, each and every one of us, individuals with personal responsibilities to assert. Surely healthcare is a responsibility. Surely it's a personal responsibility to each and every one of us.
Basically, private health insurance used to be, before the Whitlam government, used to be all there pretty much was.
Yeah.
And about 70 to 80% of people had private health insurance because if you got sick, you needed private health insurance. Gough Whitlam brought in Medibank, which was kind of a version of Medicare. That saw a drop in private health insurance. Then Malcolm Fraser got rid of Medibank, converted it to Medibank Private. Then Bob Hawke brought in Medicare, and private health insurance numbers dropped consistently to the point where by the sort of mid-1990s, around 1996, when a certain prime minister came in, it was getting close to about 30% of people. Only 30% of people had private health insurance. This is not good if you're a private health insurer. Because
it's probably good for a lot of people, but yeah.
And also the main people who had private health insurance were older people, sicker people, which meant private health insurers were not having a whole lot of customers who they were not having to pay money for.
Yeah.
They were just getting money from them. They weren't being sick. People like you, younger people who are generally a lot healthier, they weren't bothering with private health insurance because why would you?
Yeah.
So John Howard looked at this and gone, private sector not doing well. We better help the private sector. So introduced, firstly, a surcharge if you were above certain levels of income and you didn't have private health insurance, you would have to pay a surcharge.
Yep.
Like basically you'd get taxed more. And that really didn't do much because people are like, fuck it. I still don't want this shitty thing.
Yeah.
You know?
I'd rather pay the extra tax.
I still like Medicare. Yeah. So then he's like, okay, well, that ain't working. We better introduce a rebate. If you take out private health insurance and you're earn under a certain amount, we'll give you a 30% rebate on your private health insurance. We'll basically pay a third of it, essentially. That still didn't do much.
No.
You literally could not pay people to take out this private health insurance because we got Medicare, public health system, universal health coverage. If I'm sick, I'm good with the public health system. I like the public health system.
Yeah.
So in 2000, and God, I remember this very clearly because I was basically around your age back then, which gives people an indication of the age difference here. John Howard decided to introduce a thing called lifetime health cover.
Yeah.
And advertised it widely with these wonderful adverts of people standing under umbrellas and talking about when we're all covered, then that keeps all of us dry. And, you know, it was the most gross thing. What it basically was saying is, okay, the little stick of the surcharge, the carrot of the thing of the rebates ain't working. We're basically going to, in effect, force you to take this out. And what the lifetime health cover is, again, makes it sound nice. Ooh, lifetime health cover.
Sounds great.
What they're saying, if you haven't joined by the time you're 31, every year after that you're not in private health, when, let's say you join then at some point when you're, say, 50 and you're
starting to feel it.
You're starting
like
to think, actually, I might need some cover because my knees are going and various things like
surgery.
that. The premium that you will pay compared to what everyone else will pay will be 2% more for every year above 31.
That's complete. Oh my God.
Yeah.
Somewhat speechless. That's insane.
So if you waited 5 years, you're paying 10% more. If you wait 10 years, you're paying 20% more. Up to 70% more. That's when they decided we'll cap it out. So, in a sense, absolutely forcing you to take it out. And what happened was there was a sizable jump, still only got up to about 50%. So this is the thing. We have a system where the government was giving you a rebate, paying for a third of it, forcing you to take it out before you're 31, or we're going to make you pay more. And also, if you earn a certain amount, you're going to get taxed more if you don't have it. And still, half of Australians are going, yeah, but it's a shit product that I don't want. Stop trying to force me to do it. And what we've seen since then, there have been extra carrots, extra sort of incentives. Scott Morrison introduced sort of if you're 18 to 29, you're getting a discount if you take it out because... Again, what was happening, even with all of these things, young people going, why the hell would I take out this thing? I don't need it. I don't want it. Yeah. And so they're like, but that's what the health insurers need so they can make a profit. Because if you're only insuring people who are accessing your insurance, you're not making money. So a couple of things happen. One, we've got, government trying to force you to do it, people realize this. What is the smallest amount of private health insurance I can take out so I am covered by this lifetime health cover? So if I want to up the increase when I'm 55, I'm not going to get hit. That's what they quickly worked out what to do. And so the share of people with private health insurance that had massive amounts of excess and co-payments, in a sense, will say, okay, I will notionally be insured, but if I actually have to get anything done, I'll really end up having to pay 80% of the bill or something like that. And I'll do that, and that's fine because that is a lower, I pay less.
Damn, this sounds like a good idea. Maybe I should get into this.
Yeah, I pay less, and because obviously if you're taking out a coverage that, we'll cover all your costs, the insurance company is going to say, you're going to have to pay us a fair bit of money for that up front.
Through the nose,
And so people are like, give me the smallest option.
Yeah.
And so we saw a massive increase in that to the point where now that is, 88% of health insurance is that. Of people, of health insurance that has excess payments, co-payments. Then what also happened, and this happened sort of around 2018, changes in the amount of things that are covered by your private health insurance that could be excluded and still have the private health insurance be able to say, oh, no, you're still covered by the lifetime health cover. And so what we've seen is private health insurers start excluding things. So, knee reconstruction. No, sorry, that's excluded. That's not in this coverage. Various things that they're taking out.
Orthodontics or something. Yeah.
Yeah, but, just a lot of operations that are quite expensive. And so it's a case of people having now, compared to, say, 1999 or even 2000 when the lifetime health cover came in, people having more private health insurance that covers less and for which they actually will have to pay more money if they actually do get sick and have to use it. So is it really insurance? Not really.
Yeah.
It's insurance now in the sense of if you need a knee reconstruction, you can get a bed. You can get a surgeon quicker through the private health insurance, but you're still going to have to pay more.
It feels like it's insurance against getting taxed with the premium from the lifetime health insurance.
That's exactly what it is. Most people who are taking out private health insurance are taking out to avoid paying tax and to avoid the hit in premiums that is going to happen if when you're 60 you decide, actually, I probably need private health insurance now. I've developed a condition or something.
Thanks, John Howard.
Yeah, and that is not a good health outcome.
No.
Now, but within all these changes, it's tightly regulated. The government does sort of get to say, this is how much you can increase it by. They're lobbying at the moment, as I say, for about 5 to 6%. That's going to be a sizable increase. It's already over the past 20 years increased much more than wages, so it's become much more expensive. We know that insurance, this private health insurance that people don't want, is not popular. Government has to force you to do it. Plus other other insurance, especially house insurance and property insurance, which is rising because of climate change things. You combine those two together, and insurance rises are about the sort of third biggest impact on increasing inflation. Yeah. So it's a terrible system, one, because as we can see with America, private health insurance does not deliver good health outcomes. It just delivers good profit. We've got a situation now where we're calling it private health insurance, but a third of it's basically paid for by government, and that's costing about $7.5 billion a year. I wonder if the public health system could do with that $7.5 billion.
I think it could probably do quite well with that,
I'm sure, we could find a use for it.
I'm sure, some doctors and nurses would like a wage rise.
Yeah, I'm sure people who are ramping in an ambulance at the moment could think that there could be a way for spending that money rather than, let's be honest, going to private health insurers and private health providers who They might say we're health providers, but first and foremost, they're profit health providers.
Yeah.
And we know that is not a key, that is not an effective way, and yet we have swallowed for a good 25 years now this line that, we need the private health insurance to take the weight off the public health system, to ease their burden.
Ease the pressure.
And instead, we've turned it into this system where we're forcing people to take out something that clearly, if we didn't have all these government policies, no one would want, which tells you most people actually are okay with the public health system. And more importantly, more people would prefer the public health system being better funded than being forced to take out private health insurance. Because if you take away all of the if you just give them the option, you go back to where we were at the end of the 1990s and a third of people taking it out, it's the numbers don't lie.
No.
And certainly the numbers don't lie in the fact that private health insurance is not, it's not your grandparents' private health insurance. You've got private health insurance, you get sick or you use it and you realize, I'm actually out of pocket for a hell of a lot of money. And, it didn't cover that. I should have read the fine print there. And it's, when you've got a system where people are using it just so they avoid getting taxed.
Yeah, that's so that
that's a bizarre way to have something.
Profit.
Yeah. And this is the thing about 2018, I wrote a column for Guardian asking the question, is private health insurance a con? And I answered fairly definitively yes. And nothing really has changed since then, apart from the fact we had a massive global pandemic, a health crisis, and it wasn't private health that got us through that.
No.
The public system is the one that we all turn to in a crisis.
Yeah, but now it's, you can't even find a bulk bill GP appointment anywhere.
Yeah.
Yeah.
And the only other thing that's changed was, as I say, the changes that came in during the Morrison government, where private health companies were able to exclude more things and still be saying you're covered by the lifetime health guarantee. So it is more of a con now than it was.
Yeah, I mean,
and yet we still have governments who are frightened to actually say, you know what? This is a dud system. People don't want it. Maybe we should give them what they want. Maybe we should stop wasting money propping up this dud system. Whenever I think of private health insurance, it's not private. It's a bit like the self-funded retirees. You're not self-funded.
Yeah.
You're propped up by the public system. And within that as well, when you think about superannuation, which superannuation companies do best? It's the not-for-profit ones. The retail super funds are the dud funds because they care about profit, not about your return. And it's the same with private health insurance.
Yeah. I thought this was going to be maybe Australia's not that bad. Look how
Australia's
terrible
not
US
that bad.
is.
Compared to the US, we're not that bad.
But we shouldn't be smug.
Our health system, I think the key thing about our health system, especially compared to America still, even with their affordable health care or the Obamacare, as some people might know it, that was introduced by Obama, is still nowhere near like ours. It's essentially compulsory private health insurance that the government kind of will help you, with, rather than it being universal health care. And that's because, fortunately, we were able to get some universal health care, started in the 70s, done again in the 1980s. It's a very precious thing. Australians are pretty, I think, protective of it, and yet we know it keeps getting chipped away, and we know that certainly conservative governments would prefer, much like we've seen with public education, sending more people to the private system, less people on the public system. It's something that I think we need to defend, but I think also we need to be a bit more attacking about just how bad private health is and how much of a con the whole private health insurance sector really is.
We've got a federal election looming. Does the government or the opposition have any policy proposals announced yet?
No, I think, this is the one area where the opposition is always very careful because they got burnt, as people might remember, in the 2016 election with the Medi scare thing. The line that, to be honest, was very overblown, that they were going to privatise Medicare. They weren't going to privatise Medicare. They were going to privatise some of the admin aspects of Medicare, you know. And privatising Medicare is a bit of a, you're not going to privatise, you just defund the crap out of it.
Yeah.
You know? So it's a one area they're very careful about. But what happens is generally once they get in, they're very helpful to the private health insurance sector, much as they are with education. No one's ever going to go into an election saying we're going to cut public health or public education.
Yeah.
But when they get in, they either don't fund it as much as they perhaps should, and they direct more funds to the private sector, and then you get a government that comes in and wants to do something, and the opposition will say, oh, you're going to cut funding to these people on private health insurance, you're going to make life tougher. Because in effect, when you forced 45 to 50% of people to take out private health insurance, what do you then say? Oh, I'm going to get rid of the rebate. And it's like, but then I'm still going to be getting the lifetime health. It's such a terrible system that we have. And as I say, thanks, John Howard again, that it's kind of rooted deep in our psyche and in our system. And unless you make the public health system so well funded and so well provided that you are able to say, right, we're going to get rid of the lifetime health cover thing. That's the thing that would first need to go to get rid of that threat that things are going to go. And then you can start unwinding it. But again, as soon as they do that, they're going to get accused of, you're hurting people, because they'll be able to say, oh, if you take out this system, if you take away these things, it'll cost this much more. And it's a really tough fight.
Yeah.
But it's one that I think deserves to be fought because, as I say, I think the private health insurance system is a con.
Yeah.
And I think public health is good. Public services should be carried out by the public sector. That's just a gold standard. And as soon as you think that privatization will work, what you're really saying is that companies making profit from people's health is a good way to deliver outcomes. And I find that rather foolish and naive.
All right. Well, hopefully that wasn't too depressing of a conversation to everyone listening. I don't know. Hopefully we'll have something a bit more lighthearted to talk about next week.
Yeah, next week the wages data comes out. That will be very important for any hope of interest rate cuts, and that will probably be our focus.
Well, hopefully it's good news.
Hopefully.
All right. Well, we'll see you all next week then.
Thank you all for listening. We will be back next week with another Dollars and Cents. This episode was recorded on the 7th of November, and some things may have changed, but not the fact private health insurance is a con. You can find my column, Grogonomics, which has all the data showing what's going on with the private health insurance system, on the Guardian Australia site. And for more research, especially on how public services should be carried out by the public sector, go to our website, which is at australiainstitute.org.au. My social media handle is @GrogsGamut, and Elinor's is @ElinorJ_L.
Oh my God, you got it right. Did
reading.
You write it down?
I'm reading.
Okay.
Yeah.
Yeah, well.
I'm prepared. Our theme music is from Blue Dot Sessions. Have a great week. Don't be too hard on yourselves. And we'll see you all next week.
See ya.